You came in through the ER, that's too bad. Whatever. It's throwing people under the bus and not valuing the whole team that it takes to run the hospital. Imagine if food service wasn't here, what would you do? Imagine if laundry didn't come in and provide laundry, what would you do? Okay? So you need to be grateful, infinitely grateful. Grateful for the job. Have gratitude. It's always a calling to work in healthcare. No matter what your job is in healthcare, it's a calling. It's good that the job you do, and it's worthwhile, and it impacts. So you have to think, do my actions inspire people, or do they intimidate? Does my smile seem warm? Does my greeting on the phone encourage conversation? And think about that. Manage yourself up. That's the hardest part. I met an ER nurse on my way here on the airplane. She was sitting right next to me. And she had heard the words ADA. We were talking a lot about ER, and I said, have you heard the words ADA? Oh, yeah, I've read about it. We don't partner. She knew I work for Studio Group. We don't partner with you, but we're told we have to use the words ADA. And I said, well, what's the hardest part? You know, all of my partners, the hardest part for my partners is the I, where they introduce themselves and then they're supposed to manage themselves up. That seems like bragging to them. She says, I've gotten a way around that. She says, in our hospital, our name badges are worn with a lanyard. And on the lanyard, every time we get a pin, I pin it on. So I have all this bling on my lanyard. And so when I'm in a patient room, a lot of times they'll say to me, oh my gosh, what are all those pins for? And I'll pull out the one that I'm most proud of or the one I most recently got. So she says, for instance, I just got my certification in emergency nursing, and I had a patient ask me, what are your pins for? And I pointed that one out. I'm nationally certified in emergency nursing. Okay, so there's a way around it to manage yourself up and to let that patient be relaxed, to just be relaxed. They're trusting you with their care and their loved one. Commit to kindness. And I'm not going to talk too much with patients because I really want you to commit to kindness among one another. Among one another. Have a relationship with one another, meaning know a little about the other person. Go out of your way to find out, are their kids in soccer with yours? You know, did they go to the movie last Saturday and see that newest release? You know, whatever little thing that you could do. Take time to answer questions with your peers. Help them. Be able to give constructive feedback. Think about how can you word feedback that's not personal. Okay? If you have an aide who's new on the unit and comes out of a patient room and in her hand is a urine container that's not labeled and she doesn't have a glove on, wouldn't you want to give her feedback? She's new to the unit, and you could do that without it being a personal attack. And anybody can do it. It doesn't have to be the boss or the one in charge. And then sharing tips for success. You know, I met anybody from the kitchen here. I had met a wonderful guy last night. His name's John. Love John. He was the only one that came last night. He leaned forward. He asked questions. He smiled. He was engaged. John told me that he was just hired as a full-time employee, and he was happy about that. And I said to him, have you had any impact on the way the kitchen does its job? So, well, you know, I had some ideas from my last job because I worked in a restaurant before. And so I kind of put forth a couple of ideas, and some of them we can't do. But I think he said one or two were implemented, and he was really proud of that. Okay? If you have a minute, you need to go meet John. I just loved him. So we're talking healthy work environment and how can you all promote it. Compliment a coworker every day. It might be about her shoes, but that's okay. Point out a skill or an art, maybe they've done something that you would like to do, and manage that up. Never be the silent witness to gossip. Talked a bit about that. Be a team player. If somebody needs a hand, go ahead and help them. Great example that one of my hospitals did is bedside shift report. Are you doing bedside shift report or handoffs in front of the patient? No. Well, in bedside shift report at this one organization, this is where when the patient is transferred from one care provider to the next, they do it at the bedside. Little introduction, and they talk about those aspects of care that the patient might know. They might question them about side effects of the new medicine. If they've taught them about their insulin, then they might talk a minute about that. But the other part I like about bedside shift report is they all look at the IV site to make sure it hasn't infiltrated. And they get a chance to look and make sure that the IMED or the IV pump has zeroed out, so you're ready to calculate for the next shift. And the Foley bag's empty and the bed's not wet. But what this particular unit committed to is that when any of those things are found, that both the person who's ready to go home and the one who's coming on the shift in the moment stay right there and deal with it together. Teamwork. Because we all recognize that the person at the end of a shift wants to go home and the one coming on wants to have a clean slate. So out of respect for one another, that was their commitment. And I already told you to ask John to share a meal with you because he's pretty cool. Oh, never insist on only working with certain staff. Anybody done that? Because I have as a staff member. But only after I felt like I had exhausted every other avenue. So think about that before you move forward. Remember that no matter what your job is, it's about the patient. It's about the patient. I have a great little saying from an ER nurse. Any day that I don't come in like my patients do is a great day for me. And that's true. It's a great day when you're not the one in the bed. So when you think about what you're doing that may impact the patient, no matter what your job is, ask, is this what I'd want for my mother? How about my husband, my child? May not be. If there's an issue, address it head on. Your boss probably would rather want you to take that coworker side to the side in the moment and have a little private conversation. You know, when you threw that chart across the unit, that wasn't such a good thing to do, and here's why. Recognize those nonverbal innuendos when you deal with your patients and their families and even with your team. Sometimes people have a glazed look, they aren't comprehending, they don't want to be there, they don't understand. You need to be able to recognize that and maybe pause and give an opportunity for questions. So make sure that if you're saying something, that the message is going. And then hold yourself accountable. Hold yourself accountable to everything that you do. Oh, we're back to these. Values, skill, recognition. I think we're going back to values. Okay. Everybody knows the standards of behavior. You've all been introduced to them. You've all signed them. Any new employee coming on should sign the agreement to adhere to the standards of behavior. And the expectation is that you will abide by the standards of behavior and that is the heart and the culture of the hospital. And each hospital standards are going to be a little bit different, but basically they might be pretty close to the same. They set the tone. They help you understand that you may be working in the lab and you might work on the floor or you might work in IT, but the standards are the same. It doesn't matter where you work. They're all the same for everybody. They ensure an organizational culture protection. Probably have some words there about no smoking on campus. They probably have some words there about not coming to work impaired. those types of things that kind of protect the culture. Very important, the standards. And, you know, again, I didn't put your standards here, but your values, very telling. That you care for your patients above all. We exist to serve those who choose us. That's pretty heartfelt. Excellence, superior quality. Superior quality. Doesn't matter what your job is, it's needing to be superior quality care, not halfway. So when you think about that fellow who was falling in the picture, yeah, you wiped up where you could see it, but did you step back to see if you got it? Okay, superior quality in a safe environment. Integrity, honoring your commitments. I love this one because as a manager, when you'd schedule people for the Christmas holiday, it was their turn to work, you kind of hope they'd show up to work. Okay, the commitment made. That you would treat everyone with dignity and respect. Co-workers. Not just patients, co-workers. Collaboration, you work together. And fiscal accountability. So we're starting to get into the money thing. Okay. Fiscally responsible. I was a manager for about 6 weeks. And the edict came from up above that we all across the organization had to cut our budget, our operational budget, by 6%. Does that sound like sequester to you? Everybody gets cut 6%. So I didn't hardly know how to read my financial budget. Very new manager. So I went out to the staff and I said, you know, guys, we all have to cut our operational budget by 6%. Can you give me some ideas? They were labeling them right off left and right. I had more than 6% in no time. Because you all know where the waste is. You all wonder, why are they wasting this? It could be done so easy this other way. Just like John, offer it up. Offer it up. See where it goes. Fiscal accountability, part of your values. So don't wait for direction from your supervisor. Ask them. What am I doing well? What can I be doing better? And are my priorities in the right spot? I think this is important, and they may say no. You know, you may be working on that, but until you get AIDIT down, we're not going any further. Okay? Because AIDIT's important. Is there some training that I might need? Because I'm not quite sure how to use that machine. New piece of equipment on the unit. I don't know how to use it. And if I were to really be exceeding your expectations at the end of the evaluation year, or when my evaluation comes, what does that look like? What does that look like? How can I reach it? What do I need to do? And what can you do to help me get there with that training? Are you guys all registering this? Kind of a little blank stare here. Okay. I'm good with time. This was a survey that was done. It was published in 2008. And the title of it, and I have to read it because it's that small print at the bottom. How willing are patients to question healthcare staff on issues related to the quality and safety of their healthcare? So that all goes right back to your values, right? Quality, safety, very important. So they surveyed, small sampling, 80 surgical patients, and they asked this broad question at the top: how do you feel about asking certain questions to doctors and nurses? And then they listed the questions. And some of them were really easy. How long will I be in the hospital? And others were a little bit harder. Have you washed your hands? And the patients were asked to rate them on a 1 to 4, with 4 being I'd be really easy to ask that question. So the basic questions, the findings were the basic questions to the doctor about length of stay, time off work,